Welcome, everybody. My name is Dr. Margie Scherk, and my co-host and wonderful friend is Dr. Julie Churchill. Welcome to this free seminar put on by Basepaws. We wanted to talk about chronic kidney disease.
Margie, well, first of all, Basepaws, thank you very much for inviting us to talk about one of our very most favorite topics, especially if the two of us get together. Our format, we tend to have an informal style anyway, and we developed what we thought we dubbed a fireside chat because fall is in the air. I'm hailing from the Twin Cities, Minnesota right now, where it is a balmy 56 today, a very sunny and warm afternoon. And so we just want to make this a very, again, just a chat between the two of us. So Margie, tell us a little bit about yourself.
I'm a practitioner. I'm board certified in feline medicine in Vancouver, British Columbia for the past, it's a decade now. I've been strictly doing consulting and educating because I thought that because I love my patients and their people, most of them anyways. And I just felt that because I thought I might be able to help more cats and more cat parents if I was educating people in the field, educating veterinarians, educating veterinary nurses, and educating the cat parents. So that's what I'm doing. How about you, Julie?
Oh, I have the perfect job, I have to say. So I am a board certified veterinary nutritionist, and most folks don't even know what kind of weird that is, but I am a veterinarian. And after vet school, I went to further training and did 2 residencies, one in internal medicine and one in clinical nutrition. And my Ph.D. spanned both of those topics, looking at kidneys and geriatrics. And so it took so long for me to do all that learning that I got to stay at the University of Minnesota. Like you, education is my hook, but the perfect mix for me is to stay here. And about half of my job is in the clinic, seeing patients, talking to clients, and working with 4th year veterinary students. And the other half is in the classrooms, trying to increase accessibility to nutrition information.
Yeah, because nutrition is absolutely, when I'm teaching veterinarians, I always want to emphasize that no matter what we call the disease, whether it's in the kidneys or it's in the pancreas or it's in the liver or it's in wherever it is, we have to always look at hydration, nutrition, and I know you think hydration is part of nutrition. Hydration, nutrition, providing adequate pain relief, and then and making sure that everything is as low stress as possible, so that making sure that their home environment, as well as the clinic environment, but their home environment is low stress, so that cats can actually be cats, be who they are, rather than just these creatures that we live with. So, and love. Yeah.
In many ways, we're kindred spirits.
Oops, sorry, I didn't mean to swap that over, but hey, okay. We might as well get going, shall we?
Yeah, sure.
So
go ahead.
What is meant, Julie? What is meant by the name chronic kidney disease?
That's a great question. And so I'm going to give, because I'm a nerd a little bit, and because I think about the organ of the kidney, which is such a marvel, I'll give a very broad overview of what I call the anatomy and the physiology or the function of a kidney, because it is such a complicated and wondrous organ. I don't know that I can use a pointer, but the way the kidney is shaped, you can see that blood goes in, and the red is the artery, so bringing oxygenated blood, and the blue veins are taking away the waste products or the deoxygenated blood. But the main force of the kidneys, or where I'll say the functions, well, let me stay with the anatomy first. It's like this great big filter. And so again, I don't know if you can point to that picture, Margie, but the box, this tiny little sliver, is then blown up into the bigger rectangle, where you can see the blood goes into what's called a glomerulus, which I just think of as a great big sort of high pressure filter. It delivers blood to this filtering system, and it helps with water regulation and holds the big particles in the blood, like protein, like many of the nutrients.
Whoa.
Oh, wow, that was fun.
Sorry about that.
No worries. And the material that filters through the smaller particles and electrolytes and other things will go through this very complicated tubular system. And the tubules will dip down all the way through into the meat, sort of the meat of the kidney. And that is how urine is concentrated and water is brought back into the body. So if it's hot outside, and humans will sweat, but dogs and cats don't sweat very well, and so they lose water through their pads and through their tongue if they're panting. And so again, helping that water balance, that's the main function. So water goes down through a tube called ureters into the urinary bladder and then out the body. So the number one sort of priority function is to regulate water. If something causes an individual to drink a lot of water, we don't just hold it in our body, we make more dilute urine. So we pee more. Same with dogs and cats. And so again, regulating that water through whether it's very concentrated urine or very dilute urine. Because it's that filter I mentioned, it filters out the part of our food and metabolism that we don't use, so the waste products, if you will. You'll hear the term, Margie and I will use urea, which makes urine. One of the main compounds is filtered from the blood through that filter and goes into the urine. The kidney has a lot of other, many, that could be a whole night discussion, but way too nerdy for us. We want to talk about the other sort of finer points. It helps create hormones called erythropoietin and relate to creating and supporting red blood cell production. It helps make a hormone that regulates stomach acid called gastrin. It helps with conversion of vitamin D, which is very important for calcium and phosphorus balance in the body. And other parts of that filtered material are either acids and bases, because again, we want to make our blood very neutral. If we eat things that make us have more acid load in our body, the kidneys help take care of that. So again, it's really an organ of fine tuning and balance. What did I forget, Margie?
No, I don't think you did. I mean, I think the kidneys are amazing because we think of them as just, getting rid of the waste from our body, but in fact, they are incredibly important. Oh, you did forget one thing, blood pressure.
Oh, sure.
Super important in helping to regulate blood pressure as well. So that's, the anatomy and the functions of the kidneys. But when we think about chronic kidney disease, what are some of the causes of chronic kidney disease then?
Yeah, again, so many, enough to make a big exam question on a veterinary student's test. But essentially, I divide it into some main categories. Infection can harm our kidneys, either bacterial or viral. Things that obstruct the flow. So again, we know that kitties like to make stones, and those stones can either be anywhere along the urinary tract, but if it obstructs flow and urine exiting the body, it puts too much pressure on the kidneys and can cause damage.
For sure.
Looks like our arrows are a little bit wonky.
Yeah, they got wonky there, sorry.
Right. But abnormal electrolytes. So if we have too much calcium or not enough potassium, we can get what we call nephropathy, damage to the kidneys. Unfortunately, and anybody can get cancer. And so one of the cancers of the kidney, primarily something called lymphosarcoma. Toxins, again, we all know the dangers of lilies because cats like flowers, but but lilies don't like cats, and so that can cause acute kidney damage and
And,
or
and ethylene glycol, and we're coming up to the time of year where not only ethylene glycol and antifreeze, but also all of the snow globes that we have out for decoration for the holiday season and stuff, if they fall and break. And it's not that like dogs like the flavor of ethylene glycol, cats
yeah,
don't like it, but if they walk through it or they get some of it on their fur, of course, cats essentially taste their entire environment because they're always grooming themselves. So
yeah,
then they can be poisoned by that.
right. And those are so heartbreaking.
Oh,
Um,
just awful.
There can be chronic conditions or congenital conditions. You may hear the word of chronic glomerulonephritis and amyloidosis and polycystic kidney disease. We'll talk just a second about that. But essentially, many of these also, well, in sort of the I think we have a slide that comes to it, sort of the inflammation in that tubular region. When I showed the anatomy, there's a lot, in cats in particular, we say all roads lead to what's called chronic tubular interstitial nephritis. That's
Right.
inflammation.
Yes.
Inflammation.
Inflammation of that part of the kidney. We've talked about the glomerulus, talked about the tubules, and then all the stuff in between is called the interstitium. So when there's inflammation, like any of these different conditions, assuming they recover from a toxin,
Yeah.
they can end up with chronic tubular interstitial nephritis. And in fact, now this is what it looks like on the
Yep.
left when it's stained, but it is not all the cases, but the majority of cases. And we just don't know what starts this process, but and it may not be the same in all cats, which is why to assume that, if when somebody says my cat's got chronic kidney disease, that we see it as one particular thing, that may not actually be true. It may be
Probably
different
not.
things. But when we're talking about feeding too, right?
Yeah.
Should all cats with kidney disease be fed the same way? Probably not, right?
Right.
Yet another thing I think we want to also mention is that, cats and dogs with kidney disease, it's very, very different because with dogs, when they get chronic kidney disease, they, circle the drain, pardon the pun, pretty quickly, like 6 months or so. Whereas with cats, it's not a deathly diagnosis. Cats often live for 6 or 10 years with chronic kidney disease. So therefore, it's absolutely worth treating. And there's things we can do to slow the progression and improve the quality of life that they have.
Right. My own cats have lived 9 years or more with
Yeah.
CKD, and it's a delight because every day is a gift, but we want to make every day really gifted.
And enjoyable for the cat, right?
Right.
Yeah.
Right. For
Yeah.
sure.
So we got, is there anything with, different cats that are
There,
prone?
I don't know. I think go one more slide. And what we just wanted to highlight just very briefly is that certain breeds are prone to a couple of these hereditary conditions. Again, we don't exactly know the cause, but Persians are notorious for, at least we want to screen for polycystic kidney disease, and
Yeah.
our Abyssinian friends, a condition called amyloidosis.
Right.
Not typical of the general cat population, but certainly we have our radar up when we're seeing these breeds.
Yeah, and with Persians, we're also including Himalayans and
Yeah.
exotic short hairs as well from similar lineages. And there's genetic tests for that. But by and large, it's older cats, and I've certainly heard it said that if a cat lives long enough, they're going to develop chronic kidney disease. I mean, it's simply one of those things that happens, kind of like death and taxes. They're going to happen, right? So yeah. So that's where we're at with
Yeah.
that.
We sure don't, we hope it's not a certainty, but we're certainly not surprised when
Yeah.
and again,
Yeah.
cats are living longer. I know that we had the Basepaws summit on longevity or the behavior summit that had a longevity panel. And so we are seeing a significant amount of kidney disease because cats are living great long lives.
Yeah, so I'm going to just ask you, Julie. In the Guinness Book of Records, do you know the oldest cat on that was confirmed on record?
Oh, I don't. That should be trivia night question.
Yeah,
I'm
it
gonna
is
guess.
absolutely. We should have a glass of wine, not our cups of tea here. But it's a cat named Cream Puff who was in Austin, Texas, and she lived to, drum roll please, 43 years.
Holy smokes.
Yeah, and we're talking about years like Earth around the sun kind of years, not,
Yeah, not
kidney
cat years.
years kind of thing. We're talking about 365-day years. So just absolutely remarkable. Yeah.
That is. Oh
Yeah.
my gosh.
Yeah.
That's
So
incredible.
it certainly can happen.
Yeah, great. Well, that's our goal, right?
Right. Exactly.
That's our goal.
Yeah. And I'm assuming that all of you who are here listening live or to the recording are here because you love cats. Otherwise, you're just weird to be here. um, and that I mean, I'm really glad you're here because we love people who love cats, and we love people who want to help cats. And maybe your cat has chronic kidney disease, or maybe you've had a cat with chronic kidney disease and you want to know what you can do to maybe prevent it from happening in another cat, or whatever. But
So I'm going to ask you, Margie, how do
sure.
I know if my cat is developing chronic kidney disease? And we're going to say CKD to mean
Yeah.
chronic kidney disease because it's sort of our vernacular.
Yeah, and it's a bunch fewer words, so that's nice.
Yeah,
That's nice.
yeah. Can you
Well,
tell me some clinical signs?
certainly, drinking lots and peeing lots, and so here you can see the difference. These are from two of my cats. Harvey's urine is on the bottom; it's the smaller clump, and Nimitz, who has it's remarkable what he's been through, but he has chronic kidney disease, and his clump of urine is quite a bit bigger. Another thing is that you're noticing more drinking. That cats are constantly at the water, and maybe drinking from places they don't normally drink from, such as the faucet, or maybe drinking from the dog's bowl or something that they normally don't drink from. They may also look kind of thin and have a spiky coat. That's Nimitz there on the left. I have no idea who that is on the right, but just thin and having a spiky coat, and also with muscle loss, which we'll talk about later. It's really important to maintain muscle. So I'm working hard on that with Nimitz to boost his muscle. And then also low energy. And this is, just not having the same vim and vigor. And this was him after he had a severe bout of acute kidney injury and had been on dialysis. That's acute kidney injury. And we're talking about CKD, not AKI. So very, very different. But you can see at this point, anyways, he had very low energy. But it's really, really easy actually to miss because cats are really masters of disguise, and they are absolutely excellent at hiding their signs of illness. And that's because they're animals who are, while they may enjoy being with others, they're designed to hunt alone and eat alone, and therefore and defend their resources. And by doing that, in order to do that, they're the ones who have to go to the grocery store every day, and nobody else is going to get the food for them. And so they have to pretend they're fine, because if they don't, somebody else might hurt them, or somebody else may take over their resources, and they'll be in trouble. So the subtle signs of illness include these 10 things here, and it's maybe changes in how they interact with you, changes in activity, changes in where they're sleeping, how long they're sleeping, the positions they're sleeping in, changes in the amount of food or water that they're drinking, or also how they're eating or drinking. Instead of just eating their whole plate full, they may be nibbling. They may be urinating or defecating where you don't want them to, or where they didn't used to. And they're always trying to tell you something. It's never out of spite. They're trying to tell you something, because if they have an owie, and that owie could be physical or it could be psychological, if they have an owie and they keep doing the same things they always have been doing, we're not going to notice. So they need to kind of pull on our pant leg and say, hey, I'm unhappy. Bad breath can also be is certainly a sign of dental disease, can be also respiratory disease, GI disease, but it's very definitely can be a problem of kidney disease, where they've got really smelly breath. Unexplained weight loss or gain is another thing here, and we're going to harp on weighing your cat. Changes in grooming, maybe they're grooming themselves more, maybe they're grooming themselves less. Remember, this is just the subtle signs of sickness for anything, not just chronic kidney disease. Showing signs of stress, having their tail flicking, their ears in different postures, their whiskers in different places, and changes in how much they're talking or what their voices sound like. So really the key is changes. So you need to know what's normal for your cat, or you won't know where the changes are.
Yeah, and I think this audience does know their kitties well. I'm seeing some questions, and I'm going to just jump in, Margie, because
Sure.
I didn't know how to answer a question for Holly. She said, is if a cat gets a toxin, wouldn't it require immediate vet care? Or is that something that can happen as a kitten? And Holly, just in general, yes. So if they eat lilies, it's related to dose, of course, and the type of toxin, but in general, it would make your cat very sick and they would come and need to be hospitalized. And the question is whether any of that is reversible or if they're left with chronic irreversible kidney disease. But I think the point also for that tubular interstitial nephritis is that very often by the time they come to us and we're diagnosing it, we do not know what caused it.
Exactly. And with lilies, and I'll just say there's a little precious time window, and same thing with ethylene glycol. If they can be seen within 6 hours of their having ingested the lily or the ethylene glycol, there is a chance that we may be able to save some of that kidney function and have them go on to having chronic kidney disease, but being alive rather than, being dead.
Yeah. Yep.
So time is dose and time are of the essence.
Yeah.
So really of the essence. So yeah, thanks for asking that.
Yeah. If you see toxin ingestion or something you're worried about, call the poison line right away and get them in.
Yeah, and the ASPCA's got a great poison line. That's actually something maybe that somebody from Basepaws might be able to pop up in the chat box. So the reference is the phone number or for the ASPCA poison line. That'd be a good one.
Yeah.
Maybe somebody could look that up. Yeah, so I can't see the questions. I only get to see the
yeah, I'm trying to monitor, but
thank you so much.
I'm not doing a good job, and then I flubbed it, so I'll intermittently interject.
That's great. That's the way it should be done. So I guess that the next question really would be, what can a person living with a non-purebred cat, okay, which is the majority of us, or purebred, doesn't matter, but not where we're talking about the inherited conditions. What can a person living with a non-purebred cat do to reduce the chance of their cat developing chronic CKD?
Oh, we could talk for days about this, but I think you really started that discussion when you say change. I think it is so important for us to really observe what is normal for our kitty cats when they're healthy.
Yeah.
So watching what their demeanor is, I call it their life essence, because they're different. They're not all the same. And so when look for subtle signs, like don't obsess about it, but just know your kitty. And so that when you start to see changes, particularly in water, now that's a subtle thing and really hard to do. So I'm a big believer in measuring all things. And so it's harder when you have multi-cat households. And I think later Margie has a great idea on how to monitor water intake. But if I'm starting to see a cat share the dog water, that is generally, some cats like their dogs, but many don't. And so when you start to see those unusual things, or if you see that you're filling that water bowl or the water fountain more frequently, that should sort of raise some awareness that needs to be explored, because we really want to optimize hydration. I think it is the most important nutrient. So I know Margie sometimes separates the two, but it's important.
It is absolutely the most. Well, we can live for days and days without food. We can live for a month without food. We won't be doing great. But after, I don't know, how many days is it a person can't live without water? So it's really short.
Yeah, it is. It's a couple of days. It's
really short. And I think that's why when, if you hear all these, horrible natural disasters, if somebody's been trapped in an earthquake, when they get them out alive after 4 or 5 days, I'm just gobsmacked. And that's one of the criteria they use for stopping to look, because, you physiologically can't survive after a certain amount of time, for sure.
Yep, this water is so critical. And many, as Margie pointed out, many of cats that develop CKD, or by the time we diagnose it, they are in their senior years. And we know that total body water declines as we get older.
I know. Yeah, it's actually pretty remarkable. When in young cats, they're about 75% water. And in older cats, or in us, or in me anyways, I should speak for myself.
Me too.
Because I'm quite a bit older than you, I think, Julie, is it's down to like 55%. And so that's a big difference. And our cells, we still have the same number of cells, and all those cells still, if we're losing muscle mass, we still have the same number of muscle cells. They're just not as plump and robust anymore, but they still need the same amount of water. Really important to clear all the toxins out, to get all the nutrients to every cell. It is absolutely essential.
Yep. All the machinery, all the chemical, all the metabolism requires water in some way or another. So it's so vital for life.
And then the next thing that the machinery needs is energy to run everything, and that energy is what we get from our macronutrients, the things that provide energy, that provide kilocalories or calories, and that's protein, fat, and carbohydrates. And we'll talk a lot about that in a bit as well.
Right. So that's why, again, I'm a big believer in the measuring and the monitoring, is knowing your cat how, and ideally, if I get to be king, and I tell people I'm running for office in a sarcastic way, but I would love it if we all knew exactly how much our kitties are eating each day.
And by weight.
Yep.
You need to weigh it on your kitchen scale. I mean, if you don't have one, many people have them. If you don't have one, go buy one. It doesn't cost a lot, but especially with dry food in particular, if you're doing a measuring scoop with dry food, and let's say you're being really good about it and you're taking 1/4 of a cup, still there's all that space between the kibble, and that amount differs, so that from meal to meal to meal. And that's a whole nother conversation, meals or not, but from meal to meal to meal, that quantity actually differs by quite a lot. It's dramatic. So instead, if you weigh it, you'll always be sure of what they're eating. And if you don't know how much, if you don't want to do that, you can do it by difference. But personally, I think that's more work, where you put the full bowl of water on the scale, and then you when it's the next morning, when you go to fill it again, you put the partially empty bowl on the scale, and you subtract the difference. But that's to me more work. But
I'm too lazy.
Likewise, I go for what's simple. Let's see what's in this next slide here. So this is to the point again of how do you know if your cat's developing illness, period. Well, cats hide signs of illness. We often don't recognize the signs of illness because they're really good at hiding them, and they may be very, very gradual in coming on. When we tend to notice it is when there's a quick difference, where there's a dramatic difference. But usually, and I've seen this so many times, Julie, when a cat parent brings their kitty in, their beloved companion in, and they, worried because his appetite's been down for 3 or 4 days, and it started about 3 or 4 days ago, and today he hasn't eaten anything. And when I weigh that kitty and I do a percentage weight change from when we last saw the cat, maybe the cat's down, I don't know, a pound, or which is like half a kilo, which doesn't sound like a whole lot although I'd be happy if I saw my weight go down by that much. But anyways, whatever it is, it's for a cat, because they're so small, that's a huge proportion. So then I'll say that's like 20% of their weight, and the client will say to me, that cat parent will say to me, wait, what? That can't be right. First denial. And I say, well, actually it is. When you do the arithmetic, it's like, oh my gosh, could he have been sick for longer? And I say, absolutely. Cats are masters at hiding illness. I'm so glad that you brought him in, because this has been going on for some time. And now we really, we have a chance to find out what was going on and get on top of it. So weight changes are really, it's such a simple tool. It doesn't have to be a fancy blood test or genetic test or anything like that. Just weight changes.
And getting really good at body condition score, we'll talk a bit about too, because when you do it regularly, you can notice subtle changes. But if you don't have an accurate scale, which would be a baby scale for cats.
Yeah, absolutely. A really, really good thing to use. I've got my son and daughter-in-law have moved in with us, and they brought their 2 cats who are both significantly overweight, and they didn't really realize how significantly they were overweight until they saw our 3 cats and went, oh my goodness, yes, I guess their heads are supposed to be more in proportion with their bodies. And so they've been on a weight loss program, but my son is using a people scale to monitor, doing weight by difference, he plus cat and then just him, and they're not losing weight, but they are. we know they're losing weight because their body condition is changing. Body
Mhm.
condition score is changing. People's scales just aren't accurate enough.
No.
It just doesn't work. So well worth getting a baby scale.
Yep.
Other ways we can help reduce the chance of them having really progressing or developing diseases, optimizing hydration all the time, good dental care.
Right.
Basepaws had a periodontal panel as part of the behavior summit too, or not a periodontal panel, but actually it was a periodontal disease. And we know that just having poor dental health can, it discourages cats from eating, and you don't feel well and you've got inflammation going on, right?
Right.
Yeah, so that's certainly something too that we can do.
For sure. Yep.
Do you want to talk to this slide or?
Yeah, sure. We were, I know you and I can debate this for a long time, but really, in looking at it in a simplistic view, those of you that have mentioned in the chat that you have kitty cats with CKD, you're probably pretty well versed in this. But what we're doing as the veterinary care team is we want to do vigilant monitoring because we're looking for these what we call signs of progression, or signs that will indicate reduced quality of life and or reduced survival. So you know very well that we are measuring in the blood azotemia / uremia if it gets more advanced, and those are things like high serum creatinine or blood urea nitrogen. You may hear your team call it BUN. We are measuring blood pressure because
really important.
Yep.
Really important, because not only do 65% of cats with CKD have hypertension, which you won't know about if you don't measure it, but also hypertension picks on a number of organs, and
Yep.
like it has target organ damage, and the target organs include the kidneys. So with hypertension, you can hammer out you can really beat up that kidney. So very, very important. And I'm a big proponent in measuring blood pressure in every cat that comes in, starting at about 3, maybe even younger, so we can pick it up when it's early on, but certainly at 7 years of age and onward, at least once a year.
And then they get used to it too, so it's not a foreign thing, and that so it's a great way to do. So we really want to monitor. We also want to look for any signs of protein in the urine. Another sign that the filter is sort of failing, because
That's
protein
glomerulus, right?
a very, very big molecule that shouldn't go through the slits in that glomerulus. So that's an indication of damage, not just in the tubular interstitium, but upstream too. So, and again, protein, when it leaks through, just like hypertension, does further damage downstream.
Right. Yeah, and then also high blood phosphorus. That's a big one. Do you want to touch on that?
Yeah, again, we know that we watch that very closely, because that's another serious sign that the kidneys are advancing in the damage. And we know that that is linked to reduced survival. So we do everything we can, of course, to correct these things. So they're not just indicators of how are things progressing, but are they things that we can work on therapeutically or with a treatment plan to address?
Yeah, and metabolic acidosis fits in with that too, and anemia and weight loss, which we've been harping on and will continue to harp on.
Yep.
And also something we don't have on here because it's not really been shown to have a statistical significance, but it certainly affects how they feel, and that's their blood potassium level. If their blood potassium level isn't a nice, robust level, they will feel really weak and lethargic. And if you feel lethargic, you don't feel like eating, and that it just causes this whole cat chase tail kind of scenario. Yeah, and maybe later we'll also talk about the really interesting, very sexy new stuff about phosphorus that is being looked at. But so we've harped a bit. Sorry. Go ahead.
And Kate's asking a question related to that last one that said, what's causing the bad breath in CKD?
Sure.
And it's really what we call uremia, that high creatinine and BUN give off a very off odor to the breath. And as Margie mentioned, periodontal disease too go hand in hand. Many of these cats are seniors, and so very often it can be a combination of both.
Sure. And with uremic stomatitis, which is when you get the horrible horrible breath in their mouth. It smells like ammonia. Not everybody can pick it up, but with the smell, you may also see actually ulcers on the tongue or in the lips, and that's gotta hurt like crazy. I mean, we've all, you burn your tongue on hot soup or something like that, and you feel it for the next few days. And imagine just having that all the time. I mean, so yeah. So that's
Margie, here's a question for you from Jennifer. How can blood pressure be measured accurately when so many cats are stressed at the vets?
Yeah. So first off, and I was just answering questions about this for a presentation I did yesterday. Also with looking at first off, we want to. It's when it's done in the clinic. First off, it's my job as my patient's doctor to make the environment of a clinic as comfortable and relaxed as possible, or relaxing as possible, so that and this is looking for the feline friendly clinics and stuff, and where it's less stressful for cats to be in. Also, fear-free promotes this too. So then getting the cat in, having them be relaxed, giving them about 10 minutes to get used to the consultation room or exam room, as whichever you want to call it. And then, while people are talking quietly, while staff or doctor, some veterinary team are getting a history from you, and then checking a blood pressure before anybody does anything else, before you start sticking a thermometer up their butt, or shouldn't be being done when you're getting blood and urine samples, because that's kind of scary. And I don't know about you, but I don't like anybody sticking needles into me. So that it definitely can be done in a more relaxed way. But interestingly, there is no direct correlation between degree of increase and stress. In fact, some cats, when they're stressed, you'll actually see when their blood pressure is being measured, it actually will drop. So we over one of the questions I was answering today actually online was from a veterinarian, is they don't like treating blood pressures of say 180 or something like that, because cats' blood pressure is the same as ours. It's 120/80, and we use the top number really because it's more reproducible in cats and in that other species that I don't have anything to do with, and when we use that, so this veterinarian, this colleague was saying, well, what if we, I'm not going to use treat a 180 unless I want to get them on some gabapentin to help relax the cat first and then check it. And interestingly, there was a nice study done that showed that they did a crossover study, so where half of the cats were given gabapentin and then had their blood pressure checked, and the other half were given a placebo, so that they also were being handled in the same way, and had their blood pressure checked. And then they did a crossover where those who'd gotten the gabapentin got placebo, and the other ones who'd gotten placebo got gabapentin, and they checked blood pressure, and they found that there was no difference between those two groups. In fact, really interestingly, really, really interesting. So, and it was a fairly large study, so there was power to the numbers, statistical power to the numbers. So it's definitely should be done. And as Julie said, get the cats used to it. And this is why I think even with kittens, we should probably taking their blood pressure, giving them treats, and we want to be giving them treats in the clinic anyway. And while we're doing things, and so that they don't have such negative associations with the visit and everybody there. Have as few people around. Lots of different things we can do to reduce stress.
Yep. There's been a question on what kind of water should I give my cat, purified or distilled? And we might have a different answer, but I see it's the water that your cat will drink. It should be safe. It should be lead-free. It should be safe for you to consume, and then it's safe enough to get to your cat. So you don't have to go to extra miles, especially if it changes the flavor from what they're used to.
Yeah. Exactly. And in some parts of the world, the natural water that we're getting through our, for those of us who are fortunate enough to have running water in our homes, right? Not everybody, we take it for granted, but not everybody in large parts of the world don't have that. And in some parts of the world, the water is very minerally tasting, and the cat might not like it. And if that, in that case, we might want something different, but it needs to be safe. And usually tap water is absolutely fine.
I'm circling back around to the gabapentin article that you referenced, the study that you referenced, because it was a little bit of point of confusion. What Margie said is that it did not make a difference on the blood pressure. And so
That's it.
for
Okay.
certain, use gabapentin under your veterinary team's direction if you need that to de-stress the visit. It won't impair the accuracy of the measurement, but we prefer, of course, that we have a stress-free environment and you don't need it, but it won't interfere with the measurement.
And not only that, not only will it not interfere with it, it won't artificially lower it. In
Right.
fact, it probably won't even lower it.
Right.
That's the interesting thing.
Yeah.
Yeah.
Which
So this
is
was
a
that's the point.
misconception.
Yeah,
Yeah.
it won't even necessarily lower it.
Yeah.
That's pretty bizarre and pretty interesting.
Yeah.
So we've talked about risk factors for progression and survival. We've talked about getting weights, optimizing hydration, observing. We've talked about observing weight loss as an early sign, and this is really interesting stuff, isn't it? That where with chronic kidney disease, Dr. Lisa Freeman showed that weight loss actually began 3 years before diagnosis, before any of the blood work, the blood tests or the urine specific gravity changed, or before the diagnosis. I was just amazed that it starts 3 years beforehand.
Yeah. And I think if you'll advance there's a couple, you've mentioned a few studies, and really this is not dramatic weight loss per se. It can be subtle, but remember, a little bit is a big percentage in our little kitty cat population. And so it's a very subtle sign, but that's why we have this baby scale here, because it is really a great indicator of health or a sign that something's going awry if it's unintentional weight loss. So in your son's cat's case, that weight loss is desired. But
Right.
if it's unintentional weight loss, even if the cat is overweight, but you aren't actively trying to facilitate weight loss, that should be a warning sign.
For sure. And again, that's why I really like calculating percentage weight changes. And then what I'll also do is equate that to what that would be on me, and then everybody really gets how dramatic it is.
Yeah.
Because like 1 pound, maybe 20% of the cat's weight, which sounds like a lot to me, but if I multiply that by my weight, and that's like 30 pounds or something like that, 33 pounds or something like that, that becomes a wait, what?
Yeah.
How did that happen? The interesting thing with the chronic kidney disease, also weight loss, along with cancer and hyperthyroidism, weight loss begins about 2.5 years before death. And with other diseases, it may be, these subtle changes in weight may begin, 3.75 years before death as well. Yeah. So screening is really, really important. And this was a study, I made this slide based on a study which looked at 100 apparently healthy cats, 6 years of age and up. So these were apparently healthy cats who were 6 to 10 or over 10 years of age. And what they found in those cats who were apparently healthy, no clinical signs, there was hypertension in 8% of them. There was an increased T thyroid hormone level and thyroid goiter in 3 and 20% respectively. There was mild to moderate urine or protein in the urine in 25% of them. 25% of apparently healthy cats. Lymph nodes, submandibular lymph nodes were enlarged in 32%, and that is a reflection most likely of dental disease. Increased blood sugar and sugar in the urine. In the increased blood sugar, certainly some of those cats will have been from stress, but some of them will have been subclinical diabetics. Azotemia, this increase in creatinine and blood urea nitrogen, or BUN, in 29%. So this is showing up long before the cats admit to being sick and do what makes us want to bring them in to see the veterinarian. Yeah. Heart murmurs in 11%, and FIV, feline immunodeficiency virus, infections in 14% of them. So really, really important to screen. And in fact, as I like you use this phrase, the best protection is early detection. And for that, the American Animal Hospital Association and the American Association of Feline Practitioners have made these recommendations for screening, and you can look at this slide, later at your leisure, I imagine. But you can see that in young adults 1 to 6, they're recommending some blood work here once a year and a urinalysis. thyroid hormone, SDMA, which we'll talk about, blood pressure, retroviral testing, that's feline leukemia virus and feline immunodeficiency virus, doing a fecal exam. And they're suggesting that we get a baseline and then once a year, or then as is needed. From 7 years on, they're recommending every year to 2 years. And then with cats 10 years of age and up, or over 10 years of age, at least every 6 months.
Yep. So Margie, tell me, how do we diagnose CKD?
All right, so we're slipping over there. Anyways, this is blood, etc. Collecting blood and urine. I'll just get by here collecting samples. How do we diagnose? Well, for one thing, we look for trends, and we really want to look for trends because of cats hiding illness, but and changes can be really, really quick, and where we actually, it's kind of like the tip of the iceberg. But when we look for these changes, we certainly want to follow and see when our blood values, like our creatinine, are higher than the normal reference interval. But we don't have to wait till it's higher than the normal reference interval. We can watch and see how it's changing visit on visit on visit. And if we watch how it's changing between visits, then we will pick things up much, much earlier. And so we don't necessarily have to use fancy tests, fancy newer tests. We can pick things up just as early. And then the urine specific gravity, when it in a dehydrated individual, if I drink 6 cups of tea, my urine's going to be very dilute. But if I'm dehydrated and my urine's very dilute, that tells me that my kidneys aren't doing their job. And that's where there's these whole stages. Is that where you were wanting to lead here?
Oh, no, I was just, I'm following our script of our fireside chat, my friend. And so that was, we wanted to talk about the common tests. And going back to the AAFP, and there's been a couple of questions, how often do we measure the creatinine and BUN? As Margie said, it's a little age dependent, but for 10 years, I like to see them twice a year. Because my spiel about seniors is aging is not a disease. And I say that as an old person. It's not a disease, but what we do is we lose our resilience. And so everything is fine until something goes awry. And then that's, as Margie said, things can change quickly because we just can't tolerate excesses or deficiencies. And that includes water and nutrients and all those things. We just don't have that tolerance built in.
Yep. Yeah, and the key things really are urine concentration or specific gravity, as it's called, and then creatinine for kidney disease. Blood urea nitrogen is a harder one to use because there's lots of other factors that affect that. In fact, even with creatinine, neither urea nitrogen nor creatinine are made by the kidneys. They're simply cleared from the body through the kidneys. So when the kidneys no longer are functioning as well at clearing them because they're damaged, then the blood values go up.
And so no one, excuse me, no one test is perfect. So it's really the composite. We look at BUN in the context of, is this kitty eating? Because if they're not eating well, then the BUN can go down. It's a reflection of hydration as well as protein intake.
Yields.
Consumption. Yep. And creatinine, if they're losing weight, that is artificially lowered because creatinine reflects body muscle mass. So we look at BUN and creatinine and body weight and hydration. So we look at the physical exam findings and trends in the context of the BUN and creatinine. And
exactly. And then, there's newer tests out there that, perhaps some people are asking about, the SDMA or symmetrical dimethylarginine. That's one that picks up changes in the ability of the kidney to filter urine earlier, but you don't actually, if you're following the trends in your creatinine, you can pick it up just as early as if you use another test that is, a little bit more blood from your cat and more money from your pocketbook and more stress for everybody. So if we follow, this is why I'm all about, following trends. It's really, really helpful that way. I'm just
Yep.
gonna, and that's, I'm just gonna go back to where I had jumped to, sort of. Um, yeah, I think, yeah, maybe. Well, there's also like renal tests, same sort of thing. We don't need more tests. Even the SDMA is affected by, well, it's not affected by declining muscle mass. It's affected by hydration. And it's also affected by renal, the blood, the amount of blood that's flowing through the kidneys too. So, and it is affected by body weight too. As they lose weight, the SDMA is no longer as reliable. So it's a newer test, but that doesn't necessarily mean it's a better test. We've got plenty of tools in our toolkit already.
Yep.
So I'm going to ask you then, Julie, do you want to explain what this whole IRIS staging is about?
Yeah, this is a system with an attempt to help both clinicians and pet parents. That the Veterinary International Renal Society looking for a system to create guidelines to help the stages, if you will, stages 1 through 4. The goal was that it would help us identify markers, if you will, my word, not theirs, for signs of progressive damage. It would help us give a better prognosis. I know there have been a lot of questions in the chat about how often do we monitor, and why do some cats live so long and some crash and burn far too soon. So the idea behind IRIS is to give us this identification of staging, a categorization, if you will, because it helps also guide our therapy as well as give prognosis. And so,
Yeah, and I'm just going to block this
yeah,
out for a second so that
yeah,
it makes it a little bit clearer, because you can see on the left-hand side that what we're looking at is creatinine and
yep,
not blood urea nitrogen. It's not part of this staging system.
no,
And we're also, although it doesn't say this in here, for stage 1, we're looking at urine specific gravity if the urine is dilute. And you can see these different stages, 1, 2, 3, and 4. And they have different clinical signs, and there's different therapeutic goals for them. But you can see along the bottom that in all of these, in regardless of stage, we want to know whether there is protein in the urine, because that's not a good thing. And we want to find out if someone is hypertensive, because that's not a good thing either.
right. And when or if we see those things, we address them a little more aggressively or
Yep.
assertively, because we think that then if we can minimize those, we can prolong life, and not just prolong life, but quality of life. So
For
that
sure.
the cat
For
will
sure.
feel better longer.
And something that I want to point out is that we cannot apply a label as to whether a cat is stage 2 or stage 3 or whatever until that cat has been rehydrated. Because as we said, creatinine and even SDMA, which isn't on here, but they are affected by dehydration. So your cats, the creatinine value and SDMA are going to be higher in a dehydrated individual. So you have to, you got to give your veterinarian some grace, recognizing that they may say, I think that Fluffy's got kidney disease. I need to rehydrate him, and then we need to run these tests again. And while your inclination might be, but I just spent this money, we just ran these tests, why do we have to run them again? Is because we can't actually determine how much of it is from kidney disease versus how much of it is from dehydration until we remove the dehydration component, because that's the one we can remove.
Right, exactly.
Yeah. So where are we at here? Yeah.
I hope, again, the link here is posted for IRIS. There's a lot of great information for pet owners, and it's a guideline. Again, I'm not a purist, because I am older than the IRIS staging system, and I am a big proponent. It's a guideline, but it isn't a magical, oh my gosh, creatinine is 1.6. because you can see creatinine of 1.6 is really kind of in two categories. So it's a guide, and I'm a big believer in individualized care. So
And it's
your
exactly
your
tailored
vet,
to the
yeah,
individual.
yep, because your
And-
vet care team is the expert in your kitty, and this is a guideline for the average CKD population.
Well, and it gets it even stickier and stinkier because different labs
Yeah,
use
right.
different methodology, different equipment,
Yep.
and the reference ranges or reference intervals are different from lab to lab and from piece of equipment to piece of equipment. So this truly is just a guide
Yep.
and nothing more than that.
Yep.
So
I think I'm
where are we
supposed
at
to ask
there?
you how, I think we're shifting now to treatment. And I know there've been a
Sure.
lot of questions that I haven't ignored you. I hear you, lots of questions about food, because we're now shifting into treatment. So I'll let you start us off, Margie, about how do we treat CKD?
Okay, so first thing is hydration. The very first thing is hydration. We want to make sure that like a well hydrated individual, and that doesn't mean, and this is something I just really want to emphasize, it doesn't mean just giving a cat fluids when they're dehydrated. No, we want to prevent them from becoming dehydrated, which means giving them maintenance fluids. It's like you don't just exercise when you're out of shape. You exercise to maintain condition, and it's the same thing with hydration. We need to keep them hydrated. And my cat Nimitz, he gets fluids every single day. It's not, and believe me, it's actually easier to do it every day than twice a week or 3 times a week, because first off, you don't have that psychological out where, oh, can I get away with not doing it? And secondly, with the cat, he gets so used to always getting his churro treats when he gets his fluids or his temptations treats, that he knows when it's time for that. And so he's perfectly happy to put up with getting the fluids. And we warm the fluids too, so they're comfortable. Nutrition, take it away, Julie.
I'm gonna insert a tiny little sort of
Oh, sorry.
preview too. There are some kitties that don't like giving sub-Q fluids. I agree. There are many cats that, again, when we do it well and we get set the family up for success, but I have some pet parents that just, it's a no-go. And so coming to the clinic every day for fluids is also a no-go. And so when water is really what this kitty needs, there are other methods through an esophagostomy tube, and we'll talk more about that. But again, don't shy away from that, because that's another lovely way to keep hydrated that's really quite stress-free.
For sure. Yeah, for sure.
Yep.
And also, we'll talk about nutrient enriched water too,
Yep.
as well. But adding water to food, to the canned food, as much as they're willing to have you add without thinking that you're just giving them dirty dishwater. Making sure that they're getting like more canned food, having really fresh water, making sure it's washed. The bowls are washed every day and the water's fresh every day. That the bowls are in places that they feel comfortable with, et cetera, et cetera, et cetera. Lots of things in that way. But
yep. Obviously, you hear Margie and I go on and on. We are in 100% agreement about the importance of water and hydration. And then food. You can see here, we were invited to do a point counterpoint, sort of a printed debate. And I think we're probably in more agreement than disagreement, but we were charged to be on opposite sides of the fence.
yeah.
And so I guess what I'll really say is that there is not yet a consensus on the nutritional management of chronic kidney disease. I will say I believe there's consensus from my feline practitioner friends, from my nutritionist colleagues, and my nephrologist colleagues. Those are sort of the three camps in general. And I think there's fairly good consensus on late stage kidney disease, that when they eat a renal therapeutic diet, or when we can provide that for them, they will feel better, and they'll feel better for longer. The gray zone in my mind, or the slight area of controversy, is in the early stages. And so so I'll give the overview of the changes of I'll call it a kidney diet, but what I really mean is a therapeutic / a prescription diet, or renal friendly diet, kidney friendly diet, because it is a composite Lots of studies have been done throughout the ages looking for the nutrient. Is it protein? Is it phosphorus? Is it this? Is it that? And really, we don't know to that level of detail because I believe there's, I call it synergy or a combination effect. I call it the nutrient profile effect. And so if you think about, in the beginning, we talked about the functions of the kidneys and the changes that happen during CKD. We want a diet that is phosphorus restricted. We know very well, again, that's where there's consensus that phosphorus, excess phosphorus promotes progressive damage of the kidney. It's a tiny bit academic because the main source of phosphorus is dietary protein. Now, all you cat lovers know that cats are carnivores and they love protein, and I'm a nutritionist and I love to give cats protein. And so this is where I call it the Goldilocks principle. We have to get it just right. I will not agree to feed a kidney at the expense of the cat around that
Right.
kidney. I will not. So I'm trying to find that very careful balance between avoiding excess protein, but restricting phosphorus. Adding potassium or making sure that their whole body potassium is adequate, because we know low levels of potassium will promote damage and make them feel crappy. We want a diet that is balanced, again, for that acid base. It has some buffers in there. We want a diet that's enriched in the water-soluble vitamins because they're drinking a lot and they're urinating a lot. So they need those water-soluble vitamins that they're flushing out. And I believe there's enough evidence too that says omega-3 fatty acids, or the fish oils, help dampen the inflammation at the level of the kidney, that tubular interstitial inflammation. So that composite together, those are the big categories, are what I make for if I were building a kidney therapeutic diet.
And it's going to be different for every individual, what they need. It's like if I go online and I see a dress that I really, really like, and I order it, and like, this dress looks absolutely gorgeous, and I order it and I put it on myself, and I look like caca in it. It's not the dress's fault. It's not my fault. It's that it doesn't work for me. And this is why anytime I put somebody on a renal diet or any other prescription or therapeutic diet, I want to get them back in to see, does that diet work for them? Because if next time I see them in, they've lost more weight, it could be because, and more muscle, it could be because that diet doesn't work for them, for their individual needs. Or it could be that they don't like the taste of it and aren't eating enough, which again is why you need to weigh the food that you're giving, and your veterinarian needs to tell you exactly how much to be feeding to meet their caloric and nutritional needs. So it's really interesting. But we're also getting into now diets where the phosphorus level, it can be less protein restricted. Protein's good, with more phosphorus restriction in the face of so varying levels of protein restriction with still lots of phosphorus restriction. But there's also, so the stage diets, but there's also this neat thing that I'm hoping you'll address with respect to phosphorus. Are all phosphoruses in the diet the same?
Yeah, I mean, this is complicated, and I wish we had a lot more time, but I don't even think, expect great news. I'm an optimist to the core, and we will know a lot more, because I know that there are groups that are actively looking at phosphorus levels and compiling lists on pet foods. And unfortunately, I know that I gave a handout on evaluating pet foods by the WSAVA criteria to make sure these are high quality foods, because even finding that phosphorus level there are multiple forms of phosphorus. And so you're not getting enough information to just get a number. It's whether it's organic or inorganic, or how available that phosphorus is to the body. And I think we're going to learn more and more about what is the right level for healthy cats, and then again, what's the right level and form for a CKD cat.
And so when we're talking about organic and inorganic phosphorus, we're not talking about how it's grown.
No.
We're talking about the chemical structure, or where what its source is. Is it, is it animal? Is it vegetable source? What is it? And with it being, and because if you give the same amount of an inorganic phosphorus as an organic phosphorus to a cat, it's going to affect their blood phosphorus levels differently.
Yes.
And it's not the amount of phosphorus that's in the diet that's dangerous to the cat, to the cat. It's how much is in their blood. So if we can find, in the near future, hopefully, if we can figure this out and find out which form of phosphorus is better and getting sufficient for the cat's needs, but having lower levels in the blood, then we're going to be able to feed more protein, which is what cats need.
Right. And it's really what you and I want to do. If we can, especially my senior kitty cats, they need more protein. The body needs more protein, but the kidney, we have to limit it because of that phosphorus, because we're still learning about the right cocktail or the right form of phosphorus. And that's why I'm a very big proponent of companies that have extremely brilliant folks trained in not just nutrition, not just cats, but nutrition, cats, disease, physiology, and formulation. And so it takes the whole team. It's a very, very difficult job because, like Margie said, depending on the right ingredients, or not just one ingredient, but nutrient interaction. It's big science.
Yeah. I didn't mean to flip that, but we might as well talk about body and muscle condition score, because this is it's not just getting weights on your cats, because you can gain weight and lose muscle, and that's not a good thing. And the way I like to look at this body condition scoring, which is also from the WSAVA, World Small Animal Veterinary Association, and you can find this on their website in their global nutrition guideline, or toolkit rather. What the body condition score reflects the calories that you're ingesting, the amount of energy you're ingesting, be it from fat, from protein, or from carbohydrates. And if you're here in the middle, this is an ideal body condition score. You're getting the right amount of calories. Obviously, if you're down here on the left, somebody may talk about like a 1 out of 9 body condition score. You're not getting enough calories. But over here on the opposite extreme, geez Louise, on the opposite extreme, if you're a 9 out of 9, you're getting more calories than you need. And the neat thing about this is, as I mentioned, you can be you can have too many calories on board and be nice and round, like on this 9 out of 9, but not have enough muscle. And that's where muscle condition scoring comes in. And this also is from the World Small Animal Veterinary Association. And I just want to show you how I like to teach this to people. In that when you stroke a cat, you're already feeling sort of over their temporal muscles and how much muscle they've got there. And then when you stroke along their back, you're feeling it. Sometimes you feel their backbone. Other times, you have to think about it before you feel it. And then you feel like their hip bones. And then also we can see if their thigh muscles are sunken in. And so this is how you do a muscle condition score, is using your eyes and using your hands. And so when you stroke along here, the way I like to do it is if you just raise your hand, put your hand up, your palm, and take with your one finger, just feel along this part of your hand. That's sort of normal muscling along the spine. I'm not flicking here. Here we go. So along here, you have normal muscling on the spine, and you can see in cross section here, lots of nice pink muscle. Then when you go to mild muscle loss, you sort of turn your hand over and feel along your knuckles, but with your hand being flat. And you're starting to feel the spinal processes a bit more. It starts to feel a little bit bumpy, but it's not a huge difference. And you may see some sinking in of the muscle. Then when you get to moderate muscle mass, you want to kind of bend your hand just a little and feel along the knuckles. You're definitely feeling the spine now and seeing that sunken thigh, and you may even start to feel some muscle wasting on the head as well, and feel the ribs and the shoulder blades a bit more. And then severe muscle loss is you make a fist and feel right over the knuckles here, as I've shown on the bottom right hand side, and you're they're really, really exaggerated. And when we start seeing, this is very common in cats as they get older, and it's not related to disease in most cases. It's just related to age. And we really want to stop there being progression. We want to keep them here, or better still, build up their muscle. And it can be done. It takes a long time, but it can be done. And because muscle is a reflection of your body's protein levels and the amount of protein that you're able to, not only that's in the food, but that you're actually able to incorporate through digestion and absorption. And cats, as they get older, don't do that as well. So it gets to be really dangerous with restricting protein. And that's why we want to be so cognizant of getting weights, percentage weight changes, body conditions, assessing body conditions, which you can do at home, assessing muscle condition, which you can do at home. And this is we'll show this in the last slides again. So really, really important to do that.
Yep.
So what about nutritional supplements and probiotics? I can't see the questions, but I'll bet you there's some questions on that.
There's quite a few, some on adding electrolytes to water, and we don't want to do that at all. No. We do have, I know we have a slide coming up on ways to enhance water intake, but we don't want to always have fresh water available first and foremost, and then you could offer alternatives, but we don't add electrolytes to a cat's water because they generally don't drink as much.
Yeah, they're called micronutrients. Yep. Vitamins, minerals are called micronutrients for a reason, meaning that there's a very narrow threshold, and we don't want to be supplementing those things because if you exceed that threshold, you get toxicity really readily. The macronutrients, there's lots of wiggle room. The micronutrients, there's very little wiggle room.
Right.
So we've got to be really careful with electrolytes and supplements.
Right. I'm actually a minimalist, and so I would rather work a little harder to get them to eat the therapeutic foods which have the supplements built in, if they will. That's my preferred mode. Again, there are omega-3 fatty acids, and I do add them if necessary. But again, many of the kidney diets will have those already incorporated. And as you pointed out, if enough is good, more is not better, because it can cause bleeding disorders. And so I'm very cognizant of staying under what I call the safe upper limit.
Yeah, I think we've already talked a fair bit about water, but why, in what way is dehydration like a hangover? Well, I like to think of it as, I mean, I don't know if you've ever experienced a hangover. Of course, I've never experienced a hangover. No, of course we haven't. But a hangover is actually dehydration plus acidosis. Mm-hmm. And it's also oxidative stress and inflammation. And guess what? A lot of older cats are dehydrated and in a state of acidosis. And certainly our cats with CKD, absolutely, they have all of these four things in there. And so what we've got, and this is again, we've got a picture here of, and I love how my slides are popping around. They're not meant to do that. Better show up there. So there's Nimitz when he was actually really, really, really sick at the time. And you can see he looks to me like somebody with a hangover. So, the whole, and what happens with a hangover, you have obviously the headache, and but you're not eating, you're not hungry. In fact, you may be anorectic. You feel nauseous. You may be vomiting. You feel lethargic. You have pain. You're withdrawn and grumpy, and you become constipated too. And of course, when a client calls us, when you call us, you may say, my cat's not eating as much. He seems nauseous. His energy is low. He's not being as interactive as he normally is. And his stool's really dry. And we start looking for diseases when in fact, a lot of that may be simply because he's dehydrated. And so we correct that dehydration. That can make an absolute world of difference for the cat.
Yeah. There's a comment that Stephanie's cat throws up after pooping, and I think that's probably because the cat's constipated, and there's a vasovagal reflex, and it really water if we can find ways to get water in this kitty.
And I just can't emphasize canned food enough. Yep. Canned food. Mm-hmm. I used to think, it's like having dessert all the time and this sort of thing. And it's not and it's more calorically dense and it'll make them fat. And I was completely wrong. Completely wrong. It took me years into being a veterinarian to learn that in fact, canned food is is lower in calories. It has more animal protein. It's got way more water. It's way closer to the bird or mouse that they would normally be eating.
It's the easiest way to get water in a cat if they'll eat canned food.
Yep, absolutely. And then I'd also mentioned this nutrient-enriched water that's available, and you don't mix it in with their water. You don't mix it in with their food. It's a separate, its own vessel or bowl, as you wish, as you will. And healthy cats, they've not done this work in cats with chronic kidney disease, but in healthy cats who were given this nutrient-enriched water, they drank 50% more water than they did before they were on the hydrocare. Now, I've offered it to my cats. They won't eat it, won't touch it, but I've also offered it to other people's cats and they like it. So that's good. And then you said, I'd also mentioned, like in the multiple cat household, or even just in your own, if you have just one cat, this intelligent bowl is really nice because you can see it's got an app, and this app will tell you how much that your cat has each, because it's microchip activated, or it reads your cat's microchip. So if you've got a multiple cat household, you know how much each cat is drinking and how long they're spending drinking and when they were last there. And if you have a single cat, you know how much they're drinking day after day after day and week after week. So if you have a cat with diabetes or a cat with CKD or whatever, you've got a good handle on, again, these subtle changes that you otherwise might not notice.
Right. And there's a question, can a renal diet cause diabetes? The answer is no.
Absolutely not.
And can it cause muscle mass loss if it's not matched appropriately to the right cat? So again, that's about the individual.
And this is why I like to look back at the cat when I reassess the cat, when I've put them on a diet, whatever type of diet it is. If I look at that cat and they've got poor muscle mass, then I know that cat, no matter what their condition is, needs more protein. So then I'm going to try and supplement them with low phosphorus proteins, such as cooked chicken breasts in addition to their diet, or maybe switching to one of the renal diets that has more protein in it, or maybe not using a renal diet at all and instead binding the phosphorus by using an intestinal phosphate binder, or something you give your cat several times a day, ideally with a meal, but given that we're trying to get people to feed 8 to 10 times a day, that's not going to happen. So a couple of times a day to actually bind the phosphorus in the intestinal tract so that it gets pooped out rather than absorbed into the body. So there's lots of ways we can do that.
Yeah.
So we maybe honestly skip along to feeding tubes.
Yeah, there was a great question here about force feeding the renal diets to their cat, and it's actually against our hospital policy. I'm a big believer in quality of life, and so I don't coax. If you offer it to their mouth and they will eat it, that's as most assertive as I will get. When a cat's quality of life is good and the only thing is they aren't able to maintain hydration on their own and or maintain their body weight, remember that weight loss can happen up to 2 years before the diagnosis, 2 to 3 years before. So then a feeding tube is a lovely option. It's a great way to get medications in. It's a great way to offer food, but most importantly, it's sort of fresh water, and it's really a very low stress way.
Yeah, it's super easy for you. It's super easy for kitty as well. I will say that, with assisted feeding, oral feeding, it can be done in such a way that it's not force feeding. It's assisted feeding, but that's another topic on how to do that.
Yeah.
Tubes, I love tubes. Feeding tubes are not, oh my God, this is the end. This is like, something horrible. They can be used for like 8 weeks, 12 weeks to help build up some of that muscle again, get the kitty out of the danger zone, and get more nutrients into them, both calories and calories coming from protein as well as water. But when it comes to feeding cats, switching them to a renal diet, I think one of the big mistakes that we as doctors do is we're not patient enough, and we don't counsel our cat parents to go slow. And so what I like to say is this is going to take 2, maybe 4 weeks to transition them onto the new diet. And so you just be putting a little bit of the therapeutic diet, and this is anything, it's not just kidney disease,
Right.
but like a small amount of the new diet in a bowl. Then you have the regular diet that they're used to, and you put like maybe 10% of the quantity of that's in that bowl will be the new diet and 90% of the old, and see what your kitty does. And if the cat sort of, isn't interested in the new diet on its own, don't do that again. Then, day by day, or over week after week, maybe after half a week, you increase to 20% of the new food and have only 80% of the old, and so on and so on. And if you get to a point where the cat says, and I'm interested to see what you have to say about this, Julie, if you get to a point where the cat says, absolutely not, I refuse to have 70% of this new stuff and only 30% of my old, then you back down to 60% of the new and 40% of the old, because eating 60% of the new is better than eating none of the new. It doesn't have to be 100%. Of course, ideally it would be, but we're talking about quality of life, and we're not the ones eating this stuff.
Right. I mean, I think it's patience, though. I see too often, because we're in a hurry because our cats have a bad, a diagnosis that makes us worry. Sherry Ross, who did one of the clinical trials here when she was my resident mate, and she could get almost all of her cats transitioned over. So they were normal patients, normal cats that developed chronic kidney disease. It wasn't an experimental model or induced disease.
And she took 6 weeks to transition them.
Yeah, it was 8 weeks. And again, lots of food wastage. So if you just prepare yourself, because cats just need to see a new food chronically to finally accept it. And so, one, don't be in a hurry. Number two, I look at where their current diet is, and it might be very, very, very high in protein. So I can do a slow decrease. I can find an in-between diet that sometimes the cat will accept a little bit better. And that's why I really love the newer early renal diets too, because I use them.
The less severely protein restricted ones, yes.
More protein, severely phosphorus restricted. But there are some products, and I say some, senior diets that I sarcastically call kidney light, meaning that they have some of the modifications of a kidney diet, but not so severe. And then, yes, I agree with you if they're just not having it. But I'll even also try appetite stimulants.
Absolutely.
To see if that can coach that transition. I do use the probiotic Fortiflora, because some cats like the taste. And so I use that as a seasoner to see, does that spice it up and make them eat it a little bit more? I work pretty hard to try to get them to eat the right thing, but I do over a long period of time.
Exactly. I think that's really important.
Yep. There's one question too that I just feel compelled. If you have a multi-cat household and one cat has kidney disease, will the kidney diet harm the others? And I say maybe. And this is where we might disagree.
Well, what I'm going to say is, if it depends on the household. I look for the common denominator diet, which won't harm anybody, and then supplement the cats with what they need twice a day. So that, let's say you've got a kitten who absolutely, a renal diet would not be the right thing. It absolutely could harm them. But if the decrepit elderly cat is tottering along, and you just want them to eat whatever they want to eat, so you have renal diet out, but then you give the kitten food, maybe on top of the fridge, or maybe twice a day in the bedroom when you're cuddling with them, or whatever. But we so that we avoid having those problems.
Yeah, there's a question about Azadil, a probiotic supplement. There's just no evidence. It's just not effective. I wish it would work, but it doesn't. So I don't waste my money.
Yeah, I mean, I have heard a lot of people say that they think their cat. Certainly, we know that it doesn't improve the biochemical parameters, but I've heard a lot of people say that their cats seem to feel better on it. I don't use it, but veterinarians have told me that their clients think that their cats are doing better. So, hey, as long as that's not going to take away from something that from people doing something that I know makes a difference, then I'm fine with it. But otherwise, it's not something I'd reach out for. What else we got there? Because God knows we've got endless amounts of stuff here.
What about baby food? I add it with water, and baby food cats love, but it's all protein and gobs of phosphorus. So
Yeah.
very sparingly. That's a sparing thing.
Yeah, unless it's, if it's chicken breast, you're doing better than, did you know even that like chicken breast and chicken thigh have different levels of phosphorus? I have
Yeah.
no idea why. It's the same animal.
Right.
We certainly, but then that said, chicken thighs have also a lot more fat than chicken breasts. So who knows? But
Yeah.
tubes, they're so,
Yep.
Okay, so with tubes, I'd be interested to see how many people have had a cat with living with a feeding tube. And what I really love these kitty collars because they don't look as scary as a bandage does. And cats can absolutely, they come in all kinds of different patterns. They're really fun, and cats absolutely can eat with tubes in place. In fact, here's a picture of a cat eating corn on the cob with a tube in place.
Mm-hmm.
So. Do you want to, take it from there, Julie?
Yeah, my cat used to come to me and yell at me to be fed by his tube. So I'm a huge proponent because they're not nearly as scary. I think they're a lot less stress. To me, I would rather do that than sub-Q fluids. That's just my bent. Again, because the fluids don't have as much sodium in them. So if I get to choose, but plenty of sub-Q fluids sustain cats for a long time. There's a lot of questions that are beyond the scope of this that are multiple, I call it comorbidities, cats with CKD and multiple conditions.
Yeah.
And
which is very common.
We would love to talk about that, but again, we're nearing the end of time.
Well, cats get lots of things at the same time.
They do.
So should we look at tubes a bit more, or should we skip over that? What do you think?
I'm not seeing any. What kind of tube do you recommend?
Okay. Well, certainly. I mean, there's these are our basic, our basic starter tubes, and they work absolutely fine. They're very inexpensive devices. This is I got one here. This is actually it's right under there. This is a softer one. It is. I'm not sure that it's necessarily better. That's probably what you guys are using at the university. Is that right? The silicone ones?
Yep.
Yeah. And they're closer to the body, but you absolutely, because of like the kitty collars have this Velcro, you can certainly take one of the red rubber feeding tubes and
some questions on
like that.
How long can an E-tube be kept in, and how often does it need to be changed? Do you have a protocol?
Super question. Do you want to answer that, or?
No, go for it.
Okay, so the longest I've had a cat with keep an E-tube in, and this was somebody with different condition, hepatic lipidosis, and again, normally they don't need them this long, but this cat had a tube in for a year and a half, and finally ate some earthworms outside, and that got the cat eating on their own again, whatever. But it was a year and a half, and we did have to change it about every 6 months. But if it comes out accidentally, or if you remove it, you can use the same hole to slide another one in. The cat still has to be sedated for you to suture it in place, though.
Agreed.
Yeah. Any other questions you're seeing there?
Let's see. How much sub-Q fluids? What's your guideline for giving the daily sub-Q fluids?
Okay, so I use the guideline 60 milliliters per kilogram per day, and everybody thinks I'm absolutely crazy. But that's the physiologic need for the amount of water a cat needs. And if they're drinking, if they're getting lots of water in their food, they need less fluids by the subcutaneous route. The way I judge if a cat's getting enough fluids is look at the water wing that they get. I'm getting water wings now too. Yay, aging. But have the fluids all been absorbed? Do they have a fat foot or a water wing? Has that all been absorbed? If it's not been absorbed, decrease the volume that you're giving them. Don't decrease the frequency. The other guide I like to use is look at the poop. If the poop in the litter box is a log, even if it's dried up because it's been sitting there for a while and has litter stuck to it, if it's a log, that cat is well hydrated. If it's pieces, your cat is dehydrated. And I'm going to bet when you go and scoop your litter again today or tomorrow, you're going to notice if your cat has poop balls versus logs in there.
Yeah. Margie, go to your slide that shows the best way to warm sub-Q fluids. And I'll answer one more.
So here, I like to warm them, and there will be a handout that you'll see about this. I warm them if before I attach the line to the bag, okay, when it's still just the bag or the bag on its own, I can microwave it. Once you've attached this line, do not microwave it. You're going to end up with a ball of melted plastic instead of a line. So what I then do is I just keep it in a vase. I pour boiling water up to the level of the fluids, wherever that might be, and then set the timer, because otherwise I forget about it. And then come back and massage it and check it on my wrist that it's not too hot. Too hot is super unpleasant for the cat as well. And also, don't let the water ever get to where this joint is, because I don't want to know what's in her tap water bacteria wise. So just take really good care of that.
Yeah. And sub-Q fluids, it says, are they dangerous with heart murmur, a cat with heart murmur? And it's not necessarily IV fluids. We really worry about water balance and overdoing fluids, but sub-Q are fairly safe. Again, if you follow Margie's guidelines of if it's not being absorbed, then cut back. And I love the E-tubes or the G-tubes again, because you can give fresh water, and that's very safe.
And it's the natural route.
Right.
It's absolutely the natural route for sure.
So I think we're out of time.
I did want to I just thought we should just maybe just show what resources we've got here. So in addition to the handout, we also have there's the links are on here, but you can also find them hopefully in the chat box. The guidelines on selecting pet foods, and Julie mentioned this, and also the Savvy Cat Owner's Guide to Nutrition on the Internet. There is a lot of misleading information, so check the source of the information, and this is really important. And then again, lastly, there's this IRIS kidney.com website about the staging, and on the WSAVA website also body condition scoring and muscle condition scoring. And then finally, we just wanted to mention that Basepaws is trying to learn more, so that will help our cats from our existing cats to help other cats in the future to look at identify genetic health markers, as well as oral microbiome, all of the organisms in our mouths, the characteristics of these associated with chronic kidney disease, and potentially find ways to prevent or treat CKD in the future. So they're saying that if your cat is suffering from CKD and was diagnosed, preferably before they turn 5 years of age, which won't be too many of them, but still, you may qualify for a free DNA and dental health test from Basepaws. So yeah, that's gosh, there'd be any number of questions. I wish I could see them. I'm stuck here behind the slides. In fact, Julie and I are watching each other. I'm watching Julie on FaceTime because I can't see her. I'm stuck behind the slides here.
We want to thank you all. Oh my gosh, it's very humbling that you took your time out of your day to listen to our little fireside chat. I loved the time with my friend, my good friend here. You're my go-to lady for cat questions, and thank you to Basepaws for hosting this fireside chat. We're very grateful.